Good afternoon and welcome back everyone for our last live speaker event in the series we are having on the intersection between brain injury and domestic violence. Over the last 3 weeks, we've had 3 great speakers from different professional backgrounds join us and share their experience, research, and knowledge on this topic. My name is Danielle Hale and I'm an occupational therapy student who's been working with the Brain Injury Association of Virginia this summer. And if you are watching live with us today, be sure to leave any questions you have in the comment section under the video so that our speaker can address those towards the end of our event. Today we have our very own Brain Injury Association of Virginia Executive Director Ann McDonnell joining us today. She's going to be sharing some information on brain injury screening as it applies to individuals who experience domestic violence. Welcome, Ann. I'm very excited for today's event.
I'm excited for it too, Danielle. This has been a really exciting event, and thanks to you for all your help putting it together.
Yes, I'm glad to be a part of it. So to start us off, can you explain the importance of screening brain injury among individuals who experience domestic violence?
Well, yes, I can. And I think too that there's a statement to be made about screening all kinds of people for brain injury. One of the things that we know about brain injury is that it can present in lots and lots of different ways. And sometimes it can present in ways that hide the injury itself. And what we know is if you're not treating and identifying brain injury appropriately, people may not get better. It's like giving cancer drugs to a diabetes patient. So the importance of screening can't be understated in just about any population, whether that's, folks that we know that have had a brain injury, folks that have experienced domestic violence, folks that are homeless, folks that are having behavioral health challenges. We know that this is important. One of the things about brain injury is that the continuum lends itself to people looking very different after an injury. Someone who has a mild injury may walk around and be confused, maybe dazed for a little bit, have some difficulty remembering the exact sequence of events of the injury. And those folks who are more severely injured are obviously going to present very differently. They may have scarring, they may have surgical remnants of their injury. There are any number of things. But for those folks that have mild injuries, that don't have a big gaping wound in their head, that don't come across as someone who has a significant disability as a result of brain injury, screening is so important. What we know is that screening can improve the trajectory of an individual's life because we're going to get them the services and supports that they need.
Great. So kind of going off of that, what screening tools for brain injury are available and how have they been used with people who experience domestic violence?
Well, there are a number of different brain injury screening tools that have been used. Virginia even created a couple of its own for work in the juvenile justice screening arena and for a screening project that we did with the University of Virginia researchers looking at the prevalence of brain injury among individuals who may seek services, for example, from a free clinic. But in the field of domestic violence, there tends to be a couple that are used more frequently than others. One I've talked about a great deal in the past is called the HELPS, another is the CHATS, and another is the OSU. I'm going to talk about HELPS right now. So the HELPS is a very quick to administer brain injury screening tool. As it's shown here, it probably takes less than 5 minutes. It has 5 questions that are attached to it. H, did you hit your head or were you ever hit in the head? E, were you seen in the emergency room by a doctor because of that injury? L, did you ever lose consciousness or experience a period where you were dazed or confused because of the injury to your head? The P stands for, do you experience any problems as a result of the injury? And in this particular version, it gives a list of those problems that are common to individuals after they've sustained even a mild brain injury or concussion. The S stands for significant sicknesses. And this question gets at attempting to find out if there have been other things that have happened as a result of brain injury. One of the things we know is brain injury can be a risk factor for neuroendocrinology problems, meaning that your hormone system sort of goes out of whack. So we may see hormone problems and endocrine problems as a result of even a mild brain injury. So that's what the S is trying to get at. We know that in a few states, there have been modifications to this HELP screening to try to get at some things that are perhaps a little bit more specific to domestic violence. This screening is appropriate for any field, but Nebraska and Pennsylvania have taken the HELP and modified it slightly. Pennsylvania added another key question. They wanted to know, is it possible if you could be pregnant right now? Because that certainly is going to impact the types of services that someone needs. What Nebraska did was they took these same questions and they changed the way that they were presented to folks so as to be a little bit more sensitive to the domestic violence aspect. So for example, when they ask, in the H, did you ever hit your head or were you ever hit in the head? They've also added questions about strangulation because we know that strangulation and choking is a common part of domestic violence assault for many, many women. They've also gone into a little bit more detail in terms of some of the problems that folks experience as a result of domestic violence and brain injury and the intersection of those two issues. So they've gotten into a little bit more detail on some of the physical, cognitive, and emotional problems that an individual may experience. Another screening tool that's used very widely in the brain injury community is the OSU, sorry Danielle, threw you a curveball there, the OSU TBI Identification form. So this is a form that was created by Ohio State University. And as you can see, it gets into a lot of the same sorts of questions. In your lifetime, have you ever been hospitalized or treated in an emergency room following an injury to your head or to your neck? In your lifetime, did you ever have a car accident or some other moving vehicle accident that might have created that injury? Have you ever injured your head or neck in a fight or in an assault? Have you ever been near an explosion or a blast? So it asks all of these questions to determine what was the exposure to the injury. Then in step 2, what it asks is for that individual to talk about whether or not they lost consciousness, even briefly, during that event. In step 3, they go into a little bit more detail. Have you had periods of time where you've experienced multiple repeated injuries? If yes, what was the typical or usual effect? Or if no, had you been dazed? And what was the most severe effect? And as you can see down in step 1, step 2, that chart sort of takes you through asking those questions to the individual. It moves through step 2 into asking very specific information about the loss of consciousness, and then whether or not someone was dazed or confused perhaps after the injury. It also looks at, how many times an individual's been knocked out. Was it ever longer than 30 minutes? How young were you when you had your earliest brain injury? These are important questions for a number of individuals who were injured as a child, because one of the things that we know is individuals who sustain injuries as children are very often misidentified or the diagnosis is missed altogether. So it's really important to understand a lot of these different aspects, and the OSU screening's been used as well in some cases where individuals have experienced brain injury as a result of domestic violence. And the last one that I want to talk about references back to our 2 sessions ago when we spoke with Rachel Ramirez from the Ohio Domestic Violence Network. They've created a screening tool called the CHATS. And CHATS is a take on the OSU screening instrument. Rachel and her team worked very closely with Dr. John Corrigan and his team at Ohio State University to create a screen that was really geared more toward individuals who may have sustained their brain injury as a result of domestic violence. So as you can see in this particular screening, the C stands for, has anybody put their hands around your neck and made you feel choked, strangled, suffocated, like you couldn't breathe? We've already talked about how strangulation is a specific sort of subset of domestic violence, and that injury is distinguished perhaps in some ways from a direct assault to the brain. The H stands for, have you ever been hit or hurt in the head, neck, or face? The A stands for, what happened after your injury? After you were hurt, did you feel dazed, confused? Were you dizzy? Did you see a doctor? Well, no, the doctors call this altered consciousness. Sorry, I saw the doctors thing and got thrown a little bit there. But it's asking specifically for, how you felt after the injury. And they want to know if any of this stuff has been happening recently or did it happen more than once? And the T, they're getting at some of those same things we were looking for in the P and the S on the helps. They specifically refer to the things that individuals may experience after brain injury as troubles, and they categorize those in one of three ways. Physical symptoms that an individual might experience, some of the emotional side effects of brain injury, and the emotional control issues that folks with brain injuries sometimes have when they're worried and scared and confused. And then some of the thinking things that we know can be problematic sometimes for folks after brain injury, trouble remembering things, trouble concentrating and focusing, paying attention to directions, remembering what the directions were, knowing how to get started. All of those things depend on a brain that's well functioning. And many women have experienced these sorts of issues after their brain injury and reported those to us. The troubles also gets to some of the more significant and riskier aspects of this injury. They want to know if someone has ever had thoughts of suicide, if they're struggling with drug and alcohol use, and what other health issues they may be having that an individual wants to talk about. In terms of how long these screens take, you can see that some of them are more detailed than others. A basic help screen where you don't necessarily add anything into the questions is only going to take you probably 5 minutes. It's a really quick screen. But what you'll find is that you're probably going to need to ask some follow-up questions. And so the chats and the helps enables individuals to get to that. If you look at something like the Nebraska version of the help screen, which is readily available online, you'll notice that it asks a few more questions. And a screen like that might take, 10 to 15 minutes. But one of the things that's sort of an unknowable in here are the follow-up questions that do arise because of an answer that someone gives. They may need some time to sort of think about some of these things, or even to control their own feelings about revisiting such a traumatic event. So I don't think that any screening tool ever really takes longer than about 15, 20, 30 minutes as a screening tool, but obviously the follow-up for that screening may take a little longer.
Great. And so if someone uses this tool and they screen positive, or there's reason to believe that someone might have a brain injury, what are those next steps? What can we do? What resources can be provided?
Well, I think that there are a number of different ways that folks can go. The first thing that I would recommend is if you suspect that this is a problem for an individual with whom you're working, there are two things to do right away. Number one is educate yourself, and number two is reach out to the Brain Injury Association. Every state has a brain injury association or a brain injury alliance whose mission is to serve individuals who've experienced brain injury and make their lives a little bit easier. So the Brain Injury Association in your state will be a terrific opportunity for you to gain some resources, to talk to somebody who knows where you might refer somebody to a doctor or to a concussion clinic for follow-up, from a physician and staff who are knowledgeable in the rehabilitation and recovery from brain injury. Now, in terms of educating yourself, there are any number of modules that are out there. But I think that for those individuals who are working in domestic violence programs with folks who may have experienced a brain injury, some of the things that you can do that will make a noticeable difference right away is understand how better to communicate with some of these folks. If you know that they have trouble processing information, it might help you to know that and go a little slower, and only give one-step directions, or only ask one question at a time, not ask 3 or 4, because we do that sometimes. I think if we understand that folks with brain injuries can experience memory problems, we'll be far more likely to write things down that they need to remember, so that they don't miss an appointment with a counselor, so that they don't forget what the rules of the shelter are, so that they don't forget strategies that they've learned to compensate for the injury itself. The Partnership for People with Disabilities at Virginia Commonwealth University worked with the Brain Injury Association of Virginia on creating a module about the intersection of domestic violence and brain injury, and you could find that available on our website. BIAV is also working on some educational materials that are going to be specifically designed for people who are working with those folks who've experienced brain injury as a result of domestic violence to help them help their clients.
Great. Well, thank you so much for that overview of brain injury screening, why it's important, and then also what resources are available. Thank you to everyone also who's been watching and liking and supporting this video series. And if you did miss any of those previous events or want to rewatch today's, you can go on to the Facebook page, the BIAV page, and just click on the videos and be sure to leave us a comment and tell us what you thought or what you learned. But thank you, everybody, and we hope you have a good rest of your day.
Thanks.